All right, this is my home first aid kit, and this bag is, intended for obviously use within my home for addressing minor medical emergencies as well as non-medical emergencies. So, having the stuff on hand to address scrapes and, minor discomfort things and that kind of stuff, that this bag can do that. And then it's also intended for those times when medical services are limited. So maybe following a natural disaster, something along those lines where your medical services are just limited. Maybe you can't get to them due to road blockages and stuff like that. Or maybe they're not up and running yet and you need to have some medical emergency. That's what this bag is for. So I wanted my stuff to be all contained in one bag. That way, if I had to transport it, it'd be easy to transport. And so the bag itself is made by Lightning X Products. Sorry about that. It's made by Lightning X Products, and it's their large intermediate trauma bag. And it is 20 inches long, 16 inches wide, 10 inches high. Excuse me. The bag itself has very nice straps. I'll turn it around so you can see the back of it. It's got reflective striping on 3 sides, and the bottom has a PVC coating. So if you have to set the bag down on a wet environment, then your stuff inside is not going to get soaked. So spinning around here, you can see the back of the bag. Again, nice straps. They run all the way down to help support that weight. So in the back, here you can kind of get a good look at the zippers. I added zipper pulls to all the zippers on the bag. They didn't come with it. I added them, just a little piece of 550 cord on the zippers to add that. So pretty high quality bag. Really dig it. This bag would be great for, an EMT that wanted to have something in their personal vehicle. Maybe you're a, first responder, fireman or something like that in your personal vehicle. You want to have a good aid bag. I think this bag would fit the ticket. So the bag did come with a shoulder strap. Here it is. It's a decent shoulder strap, but it just got in the way. I didn't want a shoulder strap hanging over the main compartment, especially when I don't use it. My plan is to not take this bag very far. The farthest I would have to take this bag, in my estimation, is probably like to a neighbor's house. You know what I mean? Like a neighbor comes over, they're having a problem, I want to take my bag with me. I can do that. Again, nice gripping material on the shoulder pad here, and it's a good shoulder pad. Like I say, I just don't have much of a use for it right now, so it's not on the bag. The outside of the bag, this is a CPR mask, and whether or not you're going to do, even if you're doing just CPR on a family member, you still need to be using a CPR mask. And if you have any CPR training, this. People tend to throw up when you're giving them CPR, and you don't want to get that in your mouth. I don't care who it's coming from, that's gross. But you certainly do not want to aspirate vomit, and that means breathe that into your lungs. Vomit is extremely damaging to lung tissue, and so the CPR mask just prevents you from inhaling somebody else's vomit and potentially causing long-term damage to you. So CPR mask on the outside, and it's just hooked onto where the shoulder strap's at. So coming right around, what we'll do is we'll talk about this pocket down here, then this pocket, and then the 2 side pockets. So this front pocket is sort of wound prep and my tools. And so when I open this up, I'll back this up. So I wish the pocket opened up further, but because of the PVC on the bottom of the bag, it just doesn't. Now, I'm also not going to take everything out of this bag. I'm just going to point it out to you. You probably know what this stuff looks like. So a flashlight, a couple of blue chem lights, magnifying glass, some medical scissors, and a pair of forceps. This is a pocket knife, a couple Sharpies, and a pen. These are some tweezers. This is I don't know if it's sterile or not, but a syringe. and it's at least a clean syringe. So the syringe, and then a couple pairs of nitrile gloves. Now when I come back to here, I've got a pair of safety glasses. This is a surgical mask and a package of wet wipes. And so, you know, I could be very dirty, need to get my hands clean. Wound site could be very dirty, need to get that cleaned up. Whatever the case, I may want to get something actually clean before I try to disinfect it. So there's that. Some hand sanitizer. You know, you're not always going to be dealing with something where you need to put gloves on. You know, you may just be putting a Band-Aid on a scratch or something. You still want to have disinfected hands when you do that. That prevents infection. So have some hand sanitizer in there. You can disinfect your hands real quick. Put some Neosporin and a Band-Aid on, even a minor cut. You can avoid infection. So that's the reason for that. Some saline wash and some iodine. And then in this pocket is just as many alcohol wipes as I could fit without them falling out of the pocket. And so the alcohol wipes can be used to disinfect all the stuff that's in here, get it nice and clean and that kind of thing. And it can also be used to disinfect wound sites and that kind of stuff. So there's that pocket. All right. Now coming up here to the main pocket. All right, coming back up here to the main pocket. This lid, all right. This lid has 3 pockets in it. So this pocket, just a roll of athletic tape and some Coflex, some cotton balls and Q-tips, and then some tongue depressors. Now these aren't, you know, you can use tongue depressors for depressing a tongue, obviously, but they can also be used for small splints and that kind of thing. So there's that. Now coming down. This bag did come with these 4 pouches, and it also came with a divider that goes back here. And when I looked at the divider, I couldn't figure out what I would use it for, so I took it out. But you know, maybe an EMT could take a look at that and go, oh, I know exactly what I would use that for, but since I couldn't figure out a use for it, I took it out. No point in keeping it in there. Like I say, it did come with these 4 bags, and obviously for color coding your medical stuff. And so again, an EMT might have different uses for this stuff, but this is just the way I did it, kind of how it made sense to me. So yellow are like burns and scalds, red is bleeding, green is strains, sprains, and fractures, and then blue are heat-related emergencies. So either someone has too much heat, like heat stroke, or not enough heat, like hypothermia. So we'll just start at burns. Now, I'm going to take this out and show you guys this once. I'll refer to it later, but all these pouches are the same, actually, and they have this clear face, but I'll show you what I'm going to pull it out one time. I'll show you that here in just a second. So, 2 different types of burn gel, water-impregnated gauze, a couple different types and sizes of water-impregnated gauze, and then in here I have some stuff for protecting a wound after you get it bandaged up. And this stuff is very stretchy. I think you might be able to get it over a torso. You could certainly get it over a toddler's torso. We had to do that. But anyways, this is just for protecting a wound once you get it all patched up. And so I've got a nice long length of that, and that just sits in my burn pouch. Get that out of the way. Bleeding pouch. So for my pouch, obviously for dealing with blood, probably going to have wet, slippery hands. It's got a nice long zipper pull on it. Inside, 2x2 gauze, 4x4 gauze, surgical dressings, rolled bandages, and some athletic tape. Now, I don't have H bandages or anything like that in here. That, in my opinion, would fall into sort of a separate category, a separate pack, which I do have, but it's not in here. So this is just my bleeder pouch. And I have some more of that wound protectorant in there as well. I'm sorry that I don't know the name of that, but I know what it's for. So sprains, strains, breaks, whatever. So triangle bandages, a roll of Coflex, ace bandage, could probably use a couple more in there, some finger splints, and a SAM splint in the back. I'm out for time. Okay. Again, heat-related emergencies, so some space blankets for treating hypothermia and shock, some hand warmers, again, just to aid in reheating, and then some electrolyte replacement for heat stroke and that kind of thing. Again, not real deep on this pouch. Could probably use some more capabilities. Actually, as could most of my stuff. I could always use more capabilities, but this is where I'm at right now. So this is minor wound care, and so this is general boo-boos. So normal band-aids, normal size band-aids up at the top, kid band-aids, and waterproof band-aids. Coming down here, I've got, and the kid band-aids, they're a little smaller and they've got like cartoons and stuff on them. Anyways, coming down here, various sized band-aids that are relatively small. You know, if you had like a shaving cut or something, I suppose. Right over here, there is a knuckle bandage in there, but then these are also the large band-aids. If you have someone with a real banged up knee, for instance, that's where those would come in. Some closure strips, some second skin, just some generic antibiotic ointment, generic Visine for getting stuff out of eyes, and then some Tegaderm. If you don't know what Tegaderm is, I'm not going to take the time to explain it. You can look it up. It's good stuff. Recommend it. All right, this is the pharmacy, and so by way of clarification, this is not the only place that I keep things like this, and in fact, this isn't the only place that I keep Band-Aids. You know, we keep a box of Band-Aids in our medicine cabinet and that kind of stuff, but as well as some of this stuff. But I wanted to have some medical supplies that were centrally located, and so stuff that I knew was going to be here, wouldn't have to go and get. And so that's kind of the purpose of this. It isn't everything that I've got in the house. All right. Starting up at the top, Aleve, just some generic first aid gel. So for minor cuts, scrapes, burns, insect bites, and stings, just kind of some general first aid gel. Pepto-Bismol, aspirin, Zicam. This is a prescription strength Zofran, which is like for nausea and that kind of thing. Nighttime cold medicine, daytime cold medicine. 2 different types of Oragel for tooth pain. Some prescription strength hydrocortisone cream, which is anti-itch. There's also some like athlete's foot cream in there, and then some additional antibiotic. Antidiarrheal, some travel day and NyQuil, and then some Rolaids. So there's that. And that does it for the main pouch. And you know what, I'll keep rolling. Or no, that's going to end it for part 1. Thanks for watching, guys. Tune in for part 2. We'll finish up the bag here real quick. Thanks.